Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. And I'm going to walk you through this case for us that since we're still live on multiple different formats, which I'm happy about. I'll kind of walk you through and just answer some questions. And hopefully we'll be able to explain for a lot of patients who have been having a lot of questions about the different procedures that they can do for their scars. Hopefully it's a little bit clearer for them, and we can provide a little bit more understanding for what patients should go through for effective scar treatments. This is a result that I want to showcase of a patient who has of really difficult skin type because these particular scars really needed multiple different energy devices. We needed to do multiple different tools to be able to get the best possible result. And we were able to get that, but it just really did take quite a bit of work, really. So I'm happy that we were able to get that, and I'm excited that we could showcase this really after, in this case for this patient, this was after a single session for him. But a lot of times it does take multiple different sessions to be able to achieve enough improvement for a lot of patients. So I'll walk you through just kind of how I did this and overall what we could expect for patients when they have these kind of scars. I will also try to see if I could answer some questions that are coming through right now. Just give me a few moments as I kind of sort myself through that for that, but I will be happy to help you with that. Good seeing you guys on too. Thank you so much. Yeah, I mean, I wasn't sure. Nobody knew what was going to happen on Saturday. Let me just say that. I had no idea if we were going to be able to do this still. So I'm glad that we were able to do this. Will microneedling work for these scars? So not really. These are very, very deep, thick ice pick scars. So microneedling is not going to really help with that. So unfortunately, I would not recommend that for these kind of scars. There's other options. That's what I'll walk you through and talk to you about. Really, for this patient, we did TCA cross, we did excisions actually also. We did subcision. In this case, I did talar liberator subcision. And I also placed a dilute form of Radiesse for this patient as well. He's a complex case actually because of his skin type. He's also had a long-standing smoking history. I got him to quit smoking before we did treatments, but that was certainly a big barrier, though, is that the fact that he was a long-standing smoker. And I couldn't use like high intensity heat and energy devices. I did do for some focal spots a little bit of CO2 laser. Mostly I used Erbium laser. I then actually did do another session of just volume, some filler for him. But the first primary session was really where we did the talar liberator subcision. We did excisions that day. We did TCA cross, and then we also did laser. With this kind of skin type especially, I don't want to overheat the skin. We don't want to actually use a lot of heat or energy for most of the skin, but I could do it for some small focal spots, and then I blended it in with a lighter laser. The Erbium laser was really good because there wasn't much heat with that, so that's what I ended up doing for the patient. And it's it's something that takes time to continue to improve. In this case, this result is that it was after 29 weeks. And he was happy with it. We didn't do anything else since this photo was taken. As far as I know, I think at this day I did a little bit more TCA cross and a little bit of Beliful, but I haven't seen him again for a couple of years now because he's just happy in life. He's fine. Of course, we could continue to get better and better improvement whenever a patient's like this is ready. Are there any over-the-counter products that help with atrophic scarring? Well, you could always do a little bit of tretinoin is important because it could help out with the oil production and it can help stimulate a little bit of collagen, but it's certainly not going to help with these kind of scars. For more mild scars, especially scars where it's due to like oil production, you can see like they're a little bit thicker. They're a little bit wider. Those you could sometimes see shrink over time by controlling that oil. Tony Santana, good seeing you on again. Your opinion on azelaic acid and tretinoin, should I switch them on and off, deferring nights, or use together? You could do, I actually think it's probably best sometimes if you're doing azelaic acid to do either azelaic acid or tretinoin, and between those two I prefer tretinoin. And then once a week, you could do some sort of exfoliant, like some sort of chemical exfoliant, which could be potentially like a glycolic acid. That works out really nicely. So you could use glycolic acid once a week, and that works out really, really well for you. So that's what personally I would do. Really, instead of overly just overly exfoliating your skin with both azelaic acid and tretinoin, try to just use tretinoin. And then if you want some sort of exfoliant, then do something like glycolic acid once a week. Tretinoin is going to be able to do a lot really for acne, just controlling the oil production. It's over time going to stimulate some collagen production too, so it helps a little bit with scars as well. How to treat deep ice pick scars. So that's what this is. Yeah, that's what I wanted to showcase for this, because this was a good case because we had to do excisions in this case. We had to do TCA cross in this case. We did have to do a laser as well. And we had to do a lot with volume replacement. Here you could see there's a huge chunk of fat that was lost there. And he was somebody who was very, very skinny. We couldn't do fat transfer. So we opted initially for Radius because I wanted to improve his overall skin quality. And then I also did some Belifol for him. So a few different things to improve the volume and then also the texture, of course. And you can see the diameter of the scar improved over time too. So this is again 29 weeks after, and he's happy in life, and he hasn't really needed to do anything else because he feels like he's exactly where he wanted to. And also, I was really insisting that any future treatments, he also still had to stay away from cigarette smoking. I think that was also potentially a factor in there. But definitely, I see a lot of times for patients where I see certain kinds of scars in smokers, even vapors, and somehow like people started to think that vaping was safer and it was superior. You were going to be okay if you'd vape and things like that. It's not true, So in a lot of patients, we can see that there's delayed wound healing, delayed collagen response when they smoke. And a lot of times when they get acne and then they get scars, it can be really deep ice pick scars a lot of times in smokers. It's just something I commonly see. That's just something to pay attention to. Feel free to take advice take that to heart. But I know smokers they know about the side effects for the lungs and things like that, but not everybody knows what it does on your face and just that delayed collagen response. Do lasers make your skin thinner? I heard that multiple laser sessions can make our skin thinner. Is it true? Well, it's taking away a superficial layer of your skin, and then you are going to actually replenish that over time. It's going to take you about a year or so. I wouldn't say it's going to make it thinner. It's not going to make it thinner. It's not evidence that's going to make it thinner, but it is going to make it more sun sensitive, especially for that first year, as that skin now is healing and you're creating new skin. So definitely it's something that you want to pay attention to. You don't want to go really aggressive multiple times over and over and over again with lasers and energy devices. And that's why I don't do this with lasers and energy devices multiple times. I do it very, very sparingly, actually, especially in skin of color. Do it one time, try to get that optimal result, that single session. And then we'll probably, hit another laser, maybe 6 months, a year, if at all, depending on how you're healing with it or your skin type is, so I really rarely do with multiple over and over again with lasers. I'm just not a fan of that. So that's why when people say how many sessions are things, I think to myself in terms of laser sessions, very few, just one a lot of times or two. But then, yes, we do need to do more things for volume, which is not necessarily the same kind of session per se, but it's something we're going to constantly have to put a little bit of volume in there to improve that scar tissue. What is clindamycin? Clindamycin, you could do oral forms or you could do topical. And I'm assuming since you're talking about this for acne, you're talking about for topical purposes. So it's going to help with basically the Staph aureus that could potentially be causing acne. Sometimes actually, I actually prefer Dapsone because there's a little bit less resistance a lot of times, as well as I find that it's a little bit less irritating. So I usually use Dapsone as my kind of go-to for the topical antibiotic. But clindamycin's cheap though, so it's usually just something pretty common. And usually I think the lotion form is a little bit cheaper than the gel form, so it can work out pretty well for patients. What lasers do you perform for oily skin? So we use the Accure laser. The Accure laser basically targets oil glands and it normalizes it. It's a particular wavelength that just targets oil directly. So 1726, all it does is just target the oil. Doesn't hit really the surface of the skin. Doesn't trigger anything with the rest of the skin. All it's doing is just treating the oil gland. And that works out really well. We do it in patients even if they just have oil. And a lot of my patients, I do things for oil production when we're treating their scars. I want their oil under control. It's really important. So you get your oil under control so that we can be able to maximize your collagen response afterwards. And in this case, I didn't need to do it for this patient, but a lot of times I do. Actually, sometimes I do like microdosing of Accutane, isotretinoin, or we do spironolactone if it's a woman, or we do something like the Accure laser. So all those could be options there. Just we gotta do something for oil production, especially. For Nevus of Ota on skin of color, how then will you target the pigmentation without multiple sessions? Well, you actually have to do multiple sessions, really. You just can't overheat the skin in skin of color, but we can still treat it skin of color with Nevus of Ota. We use the Pico laser. We just can't use as much heat and energy as we could for other skin types. So it may take you a lot longer. It really might. Unfortunately, that's the way it is. Is scarring genetic or hereditary? Yes. There's a lot of evidence that it is. Some people in their family could have like some people are the only ones in their family with acne and scarring, and then some people, their siblings had acne, they didn't scar, but they scarred. So it's interesting. There's definitely a component where some people just have a really harsh reaction, like it's their immune response when they have acne, and it's really hyper aggressive, and they end up destroying some of the skin and destroying some of the collagen there. And occasionally it can even destroy pockets of fat as well, which could be really traumatic for patients too, because on top of the skin texture issue, they have big chunks of fat. In this case, right here, this patient has big chunks of fat that were destroyed from his acne. So it's not just the superficial surface of his skin that was destroyed. It was also those chunks of fat that were destroyed there. Do I use Aerolase Neo Elite? No, I don't. I'm not really a big fan. I'm not a big fan of just 1064 wavelength. Just like that, to be honest with you, for the vast majority of treatments for like pretty much anything. I don't really love it for pigmentation really at all. Maybe for like vessel issues, it's okay, but it's not like great for like hair removal. It's not really great for a lot of things. So it's like not great for acne, for oil. So it's like kind of, it's safer for some patients because it's like you could, you have one device that you could do a bunch of stuff, and it's hard to really burn patients with it. It's like rapidly firing, but I don't feel like it's great at really like anything I found. I'm done with 6 laser sessions last 2024. My face is improved, but my acne scars are still visible in different angles. Can it still be improved? Can I still have a clear skin? Well, thanks for the question. So Pamini saying that she's done 6 laser sessions last 2024, and she still has acne scars that are visible. So maybe that you weren't going to respond enough with just lasers and energy devices. You probably had to do something else. In this case, we did TCA cross, we did excisions, we did subcision as well. We went inside and actually broke up that scar tissue. So a few different things. It's not just about laser and energy devices. And then I also took care of his volume afterwards, which is really important. We had to do things to revolumize that area. It's not just a laser issue. Doing 20, 30 lasers a lot of times isn't going to change for the vast majority of different kinds of scars. Susie's saying, no acne till my 30s. Why is that? A lot of patients, actually, a lot of female patients especially, have reported that, sometimes in their 40s. It really is just due to hormonal fluctuations, unfortunately. So think of it really as when your hormones have fluctuated, there's a little bit more oil that could get produced during your menstrual period. And when that happens, if there's bacteria on the surface of your skin, you could end up getting a cystic lesion. And so that's potentially what ended up happening there. Even if you don't have bacteria there could actually still be like closed comedones. It still could be, some sort of scarring that could still occur. So it's really worth paying attention to that. We really want to make sure that we can control your oil production as much as we could. I'm up and saying the things acne puts some of us through, man. Absolutely, I know. Really, it's true. It's like actually one of my patients today. I was doing a consultation. She's like, it's just crazy how like something that you had, at one phase of your life 20 years ago, and you're still suffering from the scars, 20 years later, and like it's still upsetting. And you have the scars, and you have the pigmentation, you have the volume loss from it, and you have the wrinkles from it. Really, the wrinkles too. Like it's like sometimes like when these scars are like pulled down like this. You're smiling, and this patient, for example, like she has a big smile, and it's really unfortunate with what happens with these scars sometimes is they're pulling the skin down, and you're bending around the scar, and you're stretching out your skin around it. And now, like imagine different parts of the face, like on the forehead, for example, is like a big indentation. When you raise your eyebrows up there, you can see that you're bending around the scar, and it's causing more contraction. It's causing more laxity there. You're smiling around the scar like that. You're getting looser skin over time, over and over and over again. So it's interesting because it's one of the few things out there that really, a lot of people suffer from. I think 90-something% of patients can have some sort of acne breakout. And, not everybody gets scarring, but so many people get scars. Or they get like, pigmentation issues or some other consequence to it. And it's really like interesting, how it affects for people for so long. And, some people could go through cystic acne and it's not that bad of scarring. And some people could get cystic acne and they just have the worst scars. It's like, it's just terrible, terrible scars. It's really unfortunate, really tough for them. Can azelaic acid help with comedonal acne? Yes, it could. It could help with that. I do usually like, though, to help with the oil gland a little bit more, and that'll be something like tretinoin, or if you want to just do something over the counter still, you could just do different cream. And then, like I was saying earlier, you could do glycolic acid once a week, and that'll actually help as just a chemical exfoliant for some of the, just essentially just taking a little bit of a layer of your skin carefully. Do you ever see women break out in acne after removing their IUD? Yes, it's possible. Really, it really is possible. With IUDs, typically they're usually just one form of a hormone. Usually it's progesterone based, and so really your hormones are just a little bit off. And so when things shift, you take it out or something. So your hormones have a bit of a surge now to overcompensate for that, and that could end up causing more oil production. But even having the IUD, if you have a hormonal IUD, you could actually you're susceptible more towards acne. So sometimes like copper IUD could be better for some patients, or oral birth control, like something with like estrogen and progesterone, could potentially be better. Let's see. Pamemi saying, why is it that my face looks clear and acne free when I wake up and 10 a.m. onwards, the acne scars are visible again? Well, you're retaining fluid when you're sleeping. You're retaining salt and fluid. And so that gives you a bit of a puffiness, really, when you wake up. So that's really what you're seeing. I mean, that's like the easiest answer. Part of it also is that there's oil fluctuations during the day as well. So you gotta make sure that your oil is a little bit better controlled, moisturized quite a bit throughout the day as well. So that's probably what you're really noticing. But it also tells us, though, that giving a little bit of volume to you probably would be really useful for your kinds of scars. That's probably something that you should pay attention to. Is CO2 better or subcision for 14-year-old acne scar? It just depends on what kind of scar it is. It's not about the age of the scar. It just depends on the kind of scar. If it's really pulled down, then we really likely do need to do something like subcision. But if it's more just like the surface, the texture, then really what we're doing is mostly then going to be a laser. So either like a CO2 laser or an erbium laser for that. Does CO2 remove most scars after one treatment? No, so I think there's a lot of confusion a lot of times about lasers and what we do with lasers for scars. So I'll kind of walk you through that a little bit though. This case isn't exactly probably the best option for that. I'll show you, maybe actually, let me see if I have another one here. Let's see if I have, let's see here. I was showing this on Friday, actually, or Thursday. This is a good case for a CO2 laser because this one I had to do ablative CO2 laser a couple times on her. Which, like I said, I don't always do aggressive lasers on patients, but I had to do it in this case because she had very, very thick scars. You can see that right there, the hypertrophy around the scars, those edges are really, really thick. So that's where something like the CO2 laser, especially like the ablative form of the CO2 laser, will really work. It's going to help with actually smoothing down those thick elements of the scar. You could do that, or you could do, like in this case, we could have done a phenol peel as well, either option, to help with the thick elements of the scar. So that's what a CO2 laser would really be useful for. Now we then do it like a blended approach where we could go a little bit deep to stimulate some collagen production. But people seem to have this idea that like doing the CO2 essentially is just going to help with these like deep scars and it's just going to help them pop up or like resurface those. It's not really the case, actually, especially the way people do it. Most people do it like this fractionated form of the CO2 laser, which can stimulate some collagen production, but isn't great for like smoothing those edges, those thick edges down. And that's where an ablative form of the CO2 laser really is really necessary first, at least for some of that. Not like for the full face, but like some of those areas we're going to want to actually go and really high intensity and smooth it down. And that's what we ended up doing for this patient. So this patient, she's almost done with her scar treatments. I haven't seen her in a little while, but she's done a few times now. And we've done a lot with volume replacement too and things. But this is a classic example, I would say, of somebody who had thick scars that you had to do an ablative form of a CO2 laser to be able to improve this. So hopefully that explains it, because I know there's so many different questions about when you use lasers, and people seem to think that a laser is really what you're supposed to do for scars and things like that. And it's a part of it. It's definitely something that we should do, but it's not like the only thing. And it's like the certain kind of case. In this case, this is actually someone with very, very thick scars, those thick edges around the scars. So that's why we ended up doing the CO2 laser. It's like it's for certain types of scars and like a certain approach. I would need to travel to get treated by you, so I need to prepare if ever. So yeah, most of our patients, I would say 60-something%. We still have to double check where it was last year, but it's amazing. We've had so many patients who essentially come in from out of state, and most patients just go the same day. But although a lot of patients also just spend a night and then just go the next day, and that's no big deal. I don't really require you, unless it's a phenol peel, to stay around me. Really, you could just come in and leave, and we're going to be able to manage really this remotely. And as long as it's something you're doing, you're sending photos, you're wearing your sunblock and using the creams effectively, you'll be able to be safe, and we can get you through everything. What measures do you take to reduce the risk of hypopigmentation with Pico laser for Nevus of Ota on Fitzpatrick type 5 to 6? Well, most important is really going to be that we don't use like what's called high frequency, like it's really, really rapid in one particular spot. And then we, of course, don't use as much heat or energy. Typically in darker skin types with Nevus of Ota, I'm not using the wavelength, which is called 755 wavelength. I usually use a 1064 wavelength, which is a little bit deeper, less risk of that hypopigmentation, and even less risk of the rebound hyperpigmentation with that. So that's what I personally prefer to use in darker skin types. So there's a few different things that we would do. And we have two different kinds of Pico lasers. One really for more deeper pigmentation and also for tattoos. And then another really more for like the surface for pigmentation and picking it up really, really well. And then for certain skin types. It depends on, how thick it is and how many sessions you're willing to do really. What is the best treatment for light box and ice pick scars? Already been using tretinoin for a couple years. Boxcar scars respond well to a little bit of filler. Sometimes just putting a little bit of filler in there, actually undermining the scar a little bit, placing any kind of filler like Belafil or HA filler, like hyaluronic acid filler, such as like Restylane is usually what I use. All those could be options there. And then kind of gently resurfacing the edges of the scar. That's actually really useful as well. So it responds well to that, but it does take a lot of sessions, especially with boxcar scars that are pretty deep, and especially, or if you're darker skin type, we gotta be very, very careful then. The ice pick scars, like I was showing that previous photo, that's where we would use more TCA cross and excisions. That's where we would do for that. How much time is in between these two photos? This was about 18 months afterwards for this patient right over here. And she did do 2 forms of ablative CO2 laser. After we did the first session, she did have some prolonged hyperpigmentation. I had to clear that up with a Pico laser. And we did TCA cross, we did talar liberator subcision for her. And we also did dilute form of radius, as well as some Belafil as well. So a few different things actually. But in her case, it was like, you know, we had to go pretty aggressive, and she was okay with that. She knew that there was going to be downtime with it, but she just really, really wanted to get the optimal result there. What's the treatment for syringioma under the eyes? Usually we just burn those off, actually, just with a little bit of a Bovi. We burn those off, actually. So typically that's what we do, or we could use even an Erbium laser to help with that. Pamela is saying, can I have an online consultation? Yeah, you can just book it directly at my page, drqazi.com. Our prices are on there as well. And she's saying, I just got treatment recommendations. My dermatologist can perform it. I am from the Philippines. Yeah, sure. It doesn't make a difference to me if you want just have my opinion about, you know, how to do treatments and whatnot. But, you know, I guess I have to kind of say, though, if you are just only seeing me because you want like advice on what things to do for your scars, I guess kind of think, why did your practitioner not recommend that, you know, potentially? But if you know, it's good to be informed yourself and like know what to do, but like kind of something to pay attention to and just see that, like, why is it that somebody else didn't realize it or didn't see those kind of scars, and just, you know, think about that a little bit. Dr. Emery is saying, ice pick scars can be treated with hyaluronic acid fillers if HA injections continue in every month. Ice pick scars will be tough to do every month anyways, even with HA filler. If you're doing HA filler, potentially if you want to like help with like the areas where there's a lot of volume loss, you could put some volume in that like chunk. But in each individual scar, it's probably not going to help too much. It really isn't. You know, I would not say that that's going to be like the best solution for that. Definitely, it'll be better to do more like serial TCA cross and then excisions as well. Like excisions for deep ice pick scars, really useful for those. What's a good laser treatment for neckline static wrinkles? You may not do laser treatment for that. I mean, maybe it's not necessary. You could actually just do dilute radius. Actually works really well. Actually, do a little bit of subcision for that neckline and do dilute radius. That works out really well. Shonali is saying, what's the cost for subcision and how many sessions do you recommend? Usually I just do it under a single session typically, and our prices are on our site actually, so you could take a look at see that. I think all of our prices, mostly for like subcision, it could vary. I think most patients spend about $800 to $1,200 for a vast majority of things, but if there's excisions and things like that, then it could go up in price then. Do grid marks go away with time with lasers? Yes, they always have. Never have had a problem with grid marks, just that are prolonged. Sometimes it could take a little bit longer, but usually with just a little bit of tretinoin, it's essentially something that goes away pretty nicely. Initially, you may notice the reason why tretinoin could help actually is because for that first month, 4 to 6 to 8 weeks, sometimes even, you may have a little bit more oil production because your skin's really dry and you're trying to overcompensate that with that by producing a lot more oil. And as you produce a little bit more oil, you may see that your scars get a little bit wider, and you may see that like feel like there's like these grid marks and things like that. But as you start to control your oil production, you stop noticing that the scar is getting wide. That shuts down, and you allow your body to heal, stimulate some collagen production, and now you actually can see that it's a lot softer and smoother over time. So never has it been a problem where it's been something that's been prolonged for us. It's always resolves. Alex Morgan saying, hi doc, can multiple erbium laser sessions have the same effect as an ablative CO2 laser? Worried about hyperpigmentation. Good question. You know, it's tough to say. It depends on your kinds of scars. It's, you know, I like erbium lasers, but sometimes you do have to really just smooth down those edges. And if someone's doing that with the erbium laser, that's fine. If they're using like the fully ablative form of the erbium laser, like pinpoint each of those individual areas, that's fine. But typically when I'm thinking somebody's saying multiple sessions of erbium laser, they're using a fractionated form of the erbium laser, not going to really be able to achieve what we were able to achieve with the ablative form of the CO2 laser in this case, really. It depends on the thickness of your scars. A lot of that really is variable. Some people, like a lot of times, like there's some days, like I do, you know, 3 or 4 scar treatments a day. There are some days I don't even touch like the CO2 laser, rarely, but like some days I'm just only using pro-fractional erbium laser because it's just, I have fits 5 and 6 and they don't have these thick edges around the scars. And it's like not necessary. So, you know, why would I expose them to excessive levels of heat? But if we have thick elements of the scar, then yes, I would do it more for like those focal spots right there. Appreciate you being Linda. Appreciate you. Thank you. And to everybody that's been saying, I'm glad we're back on here, by the way. Thank you. It's good it's good. Yesterday, the live format for TikTok wasn't working. And I wasn't like, they were saying that servers are still down, all that stuff. So I'm glad that's all back now too. Do you prefer exosomes over PRP? I don't inject any exosomes. I only would inject PRP. And the reason why is because the FDA has actually come out with a letter against exosome injections. So something to pay attention to. And I've said multiple times that I'm not like, you know, saying the FDA is perfect. I'm not like in favor of the FDA with a lot of things, but you know, it is worth paying attention when they put out a letter and they're saying that it's risky to do injectable exosomes. And these guys have had a long time to showcase that they're safe. Exosome companies have had a long time and they haven't been able to do it still. So I don't know. Pamimi is saying, can the after photos still be improved? I think I have lighter scars than that. Thank you so much. You're so generous. I appreciate you too. They can still be improved. In fact, when she came in this day for the photo, we did a little bit more Bellafill as well as some more TCA cross. And, you know, if I see her again, we'll probably do a little bit more TCA cross or so. And we'll see if there's any more volume loss or anything like that. She is pretty close to where she wants to be, though. I'll tell you that. Pretty close. Oh, awesome. Tony Santana. Tony Santana saying, we'll see me in February. I look forward to it. Why do scars develop and how can I prevent them? A lot of times they're genetic. The biggest thing is that if you have cystic acne, take it really seriously. Do a lot of things to control your cystic acne. So if that means you got to make sure that you're using antibiotics, use antibiotics, you know, topical oral antibiotics. If that means you have to be on isotretinoin, go on isotretinoin or Accutane. That means you use the Accure laser, do that. You got to do something to control your cystic acne. That's like the biggest primary step. Other things you could pay attention to when you have cystic lesions, you could do silicone tape. Actually, it does help with the inflammation, could potentially help prevent scars. Things like that potentially are good ideas. And then also controlling your oil production will stimulate collagen production. So think of use topical tretinoin or retinoids, control your oil production or do oral medications to do that so you can stimulate more collagen. Is it true that you could do a blue light UV test to check if you have a ringworm? Yes, you could, but that would be more for like a medical dermatologist. So you consider going to that. A lot of times, actually, I used to wrestle in high school. Pretty much almost everybody had ringworm at one point, which is not actually, I guess you should say, which is kind of concerning. It just goes to show like how dirty those mats were. You know, it's like it was not a good thing. The fact that like all of us ended up getting that, and it was like kind of wild because of like it caught like when you look at it, like these mats were like so dirty and like I was rubbing my face on there and I was acne prone. I had oily skin, so things like that. I would ask my dermatologist and he was like, "Oh, it's gonna be fine. It's fine. There's no evidence that like working out or doing these things affects acne." But clearly, running around and like and rubbing my face on a dirty mat was not going to be great for my acne. So, I probably would have like avoided a lot of cystic lesions and potentially like scarring if I didn't rub my face on a dirty mat every night with wrestling. So if you have cystic lesions, maybe consider don't do. If you're like in high school, consider that. Are these easier to treat than ice pick scars? No, ice pick scars actually are easy to treat per se, it's just slower. It could take actually a long time. It could take 2 years or so sometimes to really soften those ice pick scars. Some patients, depending on your ethnicity, your oil production, it could be faster, but like ice pick scars, it's not just slow. It's just also when we could get there, it's just slower. Do tretinoin and doxycycline work together to control cystic acne? Okay, a couple things. So tretinoin and doxycycline do make you more sun sensitive, so be careful with that. But yes, they will help because they can control the bacterial component with the doxycycline, and the tretinoin helps with the oil production. But you could actually just do like a topical like dapsone, and you could do topical tretinoin, and that could probably be a better combination for you actually instead of the oral doxycycline and tretinoin. Are you running any specials or promos for Pico laser for hyperpigmentation? Our prices are on our website. What we do is actually, I'll actually kind of end with this process actually here for you guys. But with our lasers, essentially when we do these lasers, we're very, very comfortable and confident that we're going to be able to treat your skin and really get excellent results over and over again. So future sessions afterwards can be up to 55% off, really. So do the treatment, do what we say to do for the treatment, and future sessions like lasers and TCA cross when it comes to for scars, or even more Pico lasers for pigmentation. After you do your treatments, those could be up to 55% off. So just to give you an idea, just in terms of like specials, things like that, nobody else does something like that. I'll just tell you that, I'm just super comfortable and confident in the way we treat really anything that's on our menu, that we could do it exceptionally well every single time. And we know that some people do need future sessions because they just want better skin, or they just want to improve it a little bit better, and just that they have a vision in their mind. And I didn't want it so that they had to pay just like a crazy absurd amount, because I know that it's better at this point. It's like hopefully not going to be as much work too, because we've got it so much better at this point. And so there we go. And it's going to be up to 55% off. And so I stand by that. It's like we have it where our patients utilize it a ton for pigmentation. They just come once or twice a year just to rejuvenate their skin. Just a little bit. Sometimes you'll hear a story that, I went to Hawaii or something, got some hyperpigmentation, and they already did a bunch of things to clear up their pigmentation, and then we clear it up again, and now it's up to 55% off every time they do it. And for Picos, yeah, it is 55% off. What is good for oil control other than spironolactone? So you could do isotretinoin, or you could do the Accure laser. Accure laser works really, really well. So either option could be great. How often are there complications with Bellafill? What's the risk of something occurring? 20%? No, there's not a 20% risk of that, though. I mean, I have had zero problems with this, zero complications like that. The risk is really about with how someone's injecting it. So each provider is really, that's the variable in this. So some people just have a heavy hand as they're injecting. Some people aren't keeping it completely clean. So that's a factor. And there's some people do have, a process where they can stimulate a little bit more collagen production around Bellafill. And so you may have to reduce that potentially with a steroid injection. But beyond that, I don't know what that number would be. They had a study that showcased that it was less than hyaluronic acid, though, and that was years and years ago, that they actually showed that there were less adverse events, less risk of nodules compared to hyaluronic acid filler. So interestingly enough, and I think that in my practice, for the amount of filler that I dissolve so much filler around the area from San Diego, LA, Orange County. I use ultrasound to dissolve it, and I do see nodules from hyaluronic acid filler that we have to dissolve. And I would say that incidence is a lot higher than any problems that I've ever had of other people that have injected Bellafill elsewhere even. Hyaluronic acid filler, I think higher chance of running into that nodule problem. Let's see here. I was advised to use tretinoin after my 6th laser session, but my face gets irritated when washing my face. Should I stop using it? You may need a lower dose or just mix it with a little bit of moisturizer. Just do that, especially for that first week or so. You've just had a laser session, so it's going to be more sensitive. So just basically go a lot slower than what you're doing. You mix it with a moisturizer for the first couple weeks. Can you use your treatments for acne on pregnant women? Usually for pregnancy, you want to do topical azelaic acid. That's about it. And a lot of moisturizer. And if you're using, by the way, an oral antibiotic, you should avoid oral doxycycline because there is a risk for fetuses. So there's a risk for the baby with oral doxycycline. All right, guys, thank you so much. I know I missed a bunch of questions still, but that's okay. I'll be back on the rest of this week, and it's good to be back. Hopefully it's here to stay, the platform. But I'm on multiple platforms too now, so hopefully that'll help us so that situation doesn't happen again like that. All right, guys, I appreciate everybody, though. I will see you tomorrow. And I know I missed a